In this demonstration, we're going to be talking about structures of the deep head, and we're going to be using a plastinated specimen of the head that's been sagittally sectioned. So you're looking at an anterior view, but our focus is going to be on this lateral view, again, of the sagittal section. So our deep head can be divided up into a few different regions. So again, starting superiorly, we have our nasal cavity, the oral cavity, right? And then the larynx and pharynx. And you can think about your pharynx as sort of a common space that extends from the nasal cavity, so the nasopharynx, the oral cavity, the oropharynx, and then posterior to our larynx, the laryngopharynx. And that will continue on as the esophagus. But your pharynx also carries air. And we'll talk about some of those structures as we go through the different sections. So starting most superiorly with the nasal cavity, we can appreciate a portion of the nasal septum. So anteriorly, your nasal septum is going to be composed of cartilage, so it's cartilaginous, but posteriorly, we have a bony component as well, which takes components of the vomer bone, which is sort of a thin individual, so unpaired bone, as well as the perpendicular plate of our ethmoid bone. So not sort of well seen in this specimen. When you remove your nasal septum, you can start to appreciate some of the structures within that nasal cavity, including our nasal concha. So for example, we have superior, middle, and inferior nasal concha, and these are overlaid by mucosa. So that's sort of this structure that you're seeing. Deep to all of our nasal concha, we find the meati, or openings. And when we talked about the paranasal sinuses, I mentioned that your paranasal sinuses are going to drain via these meati, except for your mastoid air cells, which are not connected to the rest of the system. A really important aspect that we're going to see posteriorly in the nasal cavity in the nasopharynx region is the opening of the pharyngotympanic or eustachian tube. And so this is a connection with the middle ear. So it allows drainage from our middle ear. So for example, clinically, if you are talking about in children, placing tubes into an ear for drainage, that's going to be via this pharyngotympanic tube into the middle ear. But here we can only appreciate the opening. Okay, the actual tube itself is going to be deep. So for identification purposes, this is going to be the opening only. Okay. Your nasal cavity is going to be separated from your oral cavity by both the bony palate, so again, part of the maxillary bone and palatine bone, and posteriorly by the soft palate. So here we're going to see muscles involved with sort of elevating and tensing the palate. So your levator veli palatini, tensor veli palatini muscles, which are going to get innervation from a few of the cranial nerves we talked about, like vagus, for example, cranial nerve 10. Okay? So moving then inferiorly into the oral cavity, anteriorly here you can see the mandible, the lower dentition, and you can really appreciate how our giant muscular tongue makes up the component of the oral cavity. So we have both intrinsic muscles that are going to, again, help you sort of change the shape of your tongue, like make it a wave or a roll, whereas the extrinsic muscles help you to stick out or protrude the tongue, for example, and they have different innervation in blood supply, okay? Not seen in this specimen, but sort of deep, right, in this cavity, we're going to see tonsils, right, which are going to be immunological barriers between our external environment and our internal body. Our saliva also acts as an immunological barrier to help protect us, right, from foreign substances. I mentioned that the oropharynx, right, is going to be in that posterior aspect, and we'll talk about that more when you talk about deglutition, or the process of swallowing and the position of your palate and all these sorts of facts. As we continue inferiorly, okay, to the region of the laryngopharynx, again, that's going to be posterior to the pharynx here, and that's going to continue as the esophagus into the thorax.